We've seen a tremendous uptick of infiltrative keratitis in these patients. And what we surmised from asking the questions, taking a history, and actually having patients bring in their solutions and their lenses, that there was a correlation between the solution they were using and the actual lenses they were wearing, which really made our eyebrows go up because it's become a big issue. I think it's a combination of the two, but I think it's leaning more toward, a solution-specific problem in these patients, especially with more research that we're seeing and more practitioners seeing the problem and just learning more about it. I think it's more a solution issue. Yeah, well, I mean, it went back a long way, and we were seeing it. I think other practitioners were seeing it, but honestly, I don't think they knew what they were seeing. We would get a lot of patients from other doctors who said, you know, we're seeing this for the second, third, fourth time. They were calling it EKC, they were calling it sterile infiltrates, and it just did not have that presentation. And again, once we really dove into the history with these patients, we were really seeing that it was more of a contact lens associated infiltrative event. And again, seeing a more of a solution related issue with these patients. So we reported it to the FDA. I compiled some data on it, and you know, it has now come to 2 papers, 2 posters at ARVO, and we've probably seen over 130 to 140 patients, and it's about a 60% replenish issue in these patients, which is obviously larger than the market share. I stress both, especially the disinfection. Because it's important that these patients don't get these events back. I mean, when you have a young teenager in the chair and the mom's upset because the child has a red eye, I stress that this is going to help fix the problem. And then obviously I want them to be comfortable also with the solution, so I think it's twofold. Patients that have had these events I monitor very, very closely. New fits, because of my confidence in RevitaLens, I tend to see them just on a biannual basis, so I'll see them 6 months and then 12 months. We've taken a much harder stance now on trying to educate our patients, and I think that's probably one place where our practice, we've been a little lax in the years, thinking that, you know, they were doing okay with what they were using, but we've instituted with our staff now a real education process to really make these patients aware that, you know, what we want them to use is what we want them to use for a reason, and you know, that $1 or $2 at the shelf really is not a trade-off for their ocular health. So my staff has done a very good job in educating these patients now. We found actually talking to the patients works really well, and we do send them home with written instructions. And we just stress to the parents, because we find it's actually the parents, because a lot of these are college kids, teenagers that we'll see, and the parents actually switch solutions on the kids because they see it cheaper. So we really try to stress to the parents that this is what we want their son or daughter to use. I think initially I was switching only the patients that had problems. Now I'm actually seeing, you know, from the data we're seeing as far as how good RevitaLens is working as far as disinfection and comfort, I've tended to switch all my patients.